Hello, I'm Andy Reid, STI tester with Hudson Valley Community Services. I'll also be your host for tonight's virtual observance of International Overdose Awareness Day. Ioad, as it's called for short, is a global remembrance of all those lost to substance overdose. We also call attention to life-saving interventions that can reverse overdoses. HVCS and the Centre of Recovery, two divisions of Cornerstone Family Healthcare, have partnered with Team Newburgh to bring you this Facebook Live event. International Overdose Awareness Day is especially poignant this year since the number of overdose fatalities broke a record in 2020. In the United States, more than 93,000 people died from substance overdose. Nearly 600 overdosed here in the Hudson Valley alone. We have to bring this number down. This was a crisis made even worse by COVID-19 and the subsequent pandemic. We must reduce the stigma around substance use disorder, make it easier for people to seek and get help, and train more people on how to use NARCAN. NARCAN is a pharmaceutical intervention that stops overdoses. Many agencies, including HVCS, hand out NARCAN kits to anyone who takes a training. That training is coming up later in this video. After you watch it, you can contact us to receive a free kit with 2 doses of NARCAN. Before that, we have a few videos from our staff and from other community providers with their perspective on the overdose crisis and Ioad. Feel free to use the comment section here on Facebook to share your names of those you want to remember or share your message of hope with others. But first of all, we want to take a brief moment of silence in memory of those who have lost to overdose.
Is Frank Barone. I'm going to read you a little free verse poetic piece that I wrote. This is kind of the way I see the opioid epidemic. It's called the fentanyl blues. Okay, here goes. The legality of substances is not in regards to safety, but to monetary gain. Greed is the worst drug of all, and it is to blame. Most doctors think we're junkies without feeling the pain. It's not fair. We should have a safe place to use heroin and cocaine. Fentanyl contaminates many powders, and individuals are blind to its power, hour after hour waiting for him to answer, more important than a shower. I gave my life to this drug, heroin, and I made it out alive. You can be safe while you use. You don't have to die. If heroin whispers in your ear, don't listen. It's a lie. Harm reduction programs are people that care. We just have education and clean works. Yeah, we will share. Oh, and if you're having sex, here's a condom. Don't go bare unless you want to. I'm not here to judge.
Hi, I'm Andy Reid. Welcome to International Overdose Awareness Day. With me, I have Karen Williams, a colleague and friend of mine from Hudson Valley Community Services, and I'm honoured to be in the presence of Dawn Wilkin. Dawn is the Director of Prevention Services at Catholic Charities of Orange, Sullivan and Ulster counties. She is New York State credentialed prevention specialist in substance use prevention with over 20 years experience. Dawn is a main player in community organising in Dutchess, Orange and Sullivan and Ulster counties. She has also provided training in the field of substance use prevention of local, state and national forums, and her work in the field of opioid use prevention and intervention has been covered nationally by media outlets such as the Associated Press and the New York Times. Welcome to both of you.
Thank you. You made me sound awesome. Thank you.
You are awesome. Now, the first question I'm going to ask you, Dawn, is what does International Overdose Awareness Day mean to you?
To me, it means a day of recognizing the disease of addiction. It is a day of recognizing the cost that overdoses have on our society, whether it be a physical cost, whether it be an emotional cost or a mental cost, to the loved ones of everyone around. And it's a day for education to help break that stigma surrounded with substance use and those individuals who do overdose. It's an important day.
So, Dawn, how much of an issue is overdose in our society currently?
Currently, prior to the pandemic, it was a big issue. During the pandemic, it really spiked, and it's still spiking. We're still currently in an epidemic during a pandemic, so the overdoses are continuing. One of the things that we did to try to help address that was work with Competitive Solutions, Inc. and other partners like the National Guard Counter Drug Task Force on an app called PureRx, which does real-time. It's like Uber. It's Uber for hospitals or other agencies to get a peer their quick links. We needed to change the access to getting help. And so what that has done has changed the time from waiting for a peer to come connect with someone who has experienced an overdose from an hour and 40 minutes to under 10 minutes.
That's fantastic.
Yeah, so we're finding great success with that modality in New York and outside of New York State.
Now, Dawn, in terms of prevention, what measures being taken currently do you think are having the biggest impact on overdoses in our society at the moment?
I think there's two main focuses. Obviously, education to families, education to those who are struggling with the addiction as well, right? There's a lot of education that still needs to be done in those areas. I think that stigma is a big issue and that prevention can help to address. And I think the other big one is NARCAN, getting trained in NARCAN, friends, family, or those who are struggling with the addiction as well. So that should someone overdose, you're giving them a second chance at life. They may not necessarily die from the overdose or pass away. They could live and have the potential to try to get some help. And that's really what we're looking for, right? It's just another day where they can contemplate getting the services and the help that they need to break that cycle.
So, Dawn, it's been a pleasure. We want to thank you for being part of, International Overdose Awareness Day, because I know you're very busy and taking the time. We just want to appreciate, you taking the time out to be a part.
Thank you for having me. Thank you so much.
Yeah, and I echo that, Dawn. Thank you very much.
Thank you so much.
Hi, welcome to International Overdose Awareness Day. Today we have Regina Sislik from Catholic Charities, and she is the Assistant Director of Prevention Services for Orange, Sullivan and Ulster counties. Welcome, Regina.
Thank you, Andy. I'm so happy to be here with you.
Thank you, and it's a pleasure having you here. And welcome, Karen. How are you doing?
Thank you. So, Regina, I wanted to ask you, what does International Overdose Awareness Day means to you?
Well, I think as being part of the prevention community, it's very important for us to remember the impact that overdose has on our communities, and part of what we do in prevention is try to prevent these tragedies from happening. So this gives us time to pause and reflect on what is happening in our communities and give us that incentive to continue to do what we need to do to help people not have to lose family members in this way.
Sure. Now, Regina, how important is NARCAN training in reducing the instances of overdose that takes place in our towns and cities? I know you do NARCAN training.
I will tell you my personal is that when I came back to Newburgh to start working in prevention and heard about NARCAN and NARCAN trainings, I wanted to be trained immediately because I am out and about in the community. I work with a number of different groups, and personally, it would have destroyed me to come upon someone who was having an overdose and know that there was something out there to help them and not have it at my disposal. So I kind of have my own little crusade on NARCAN. I've trained people individually. I've done classes. I've trained nurses and medical staff and probation, and whoever would listen to me and wants me to be there. I've offered to train family members privately so that nobody had to know that they had anyone in their family who, was using. It's extremely important to me. If I've worked my whole life in trying to help people, and this is such a no-brainer. It's such an easy thing to do. It's so easy to carry with you. Why wouldn't you do it?
Sure.
True. I know that the Newburgh team, I just wanted to know, like, what role do they play in tackling overdose in the communities, especially in Orange County?
So Team Newburgh is a community coalition, and our goal is really to educate. As Catholic Charities, I can provide NARCAN trainings. Team Newburgh, their goal is more to educate people. We can coordinate trainings for people. We can, we try to educate people on the substances that are out there and what to look for and how to work with your children and your families to make them aware of what their decisions, the impact of their decisions have on them. Although we are Team Newburgh in substance abuse, we with our evidence-based programs that we have, like Too Good for Drugs and things like that, we are really working with the children to help them to make good decisions, to know what peer pressure is, to be able to counteract that with, these peer pressure refusal strategies, things like that. Our goal is really to educate, and that's what Team Newburgh tries to do. We're out in the community, we're handing out information. We have, with the help of the National Guard and CVS and the Newburgh City Police Department, we put a drop box in the lobby of the police department where people can drop off unused prescriptions. We also give out lock bags and lock caps. We have, prescription tracker cards. We have deterra bags, which are drug disposal packets. It's kind of twofold. It's to educate and it's to provide safe storage and disposal for the community.
And you do it very well, and I really appreciate it. And thank you for that, Regina. Thank you.
You're welcome.
And it just shows that, that the Newburgh team is so important and the vital work that you guys are doing. And I just want to thank you for taking the time out, and I know you're on vacation, to be here and be a part of this, movement or this event. I just want to thank you, Regina.
Well, I thank you for asking me. I've been part of this event for a number of years working with you guys, and I couldn't be happier to do it. It's not a problem at all. I was glad to be a part of it. Thank you for asking me.
And we're honored to have you on. Thank you very much, Regina.
Okay.
Hi, welcome to International Overdose Awareness Day. With me, I have Christine Southwell of the Syringe Exchange Programme. She is the SEP Supervisor for Orange, Sullivan, Ulster and Dutchess and Rockland counties. Welcome. How are you doing? So I'll jump right in, Christina. What does International Overdose Awareness Day mean to you?
So International Overdose Awareness Day to me means remembering those who we have lost to overdose, as well as getting information out there so we can help people prevent overdoses.
And what type of services does the SEP program attempt to offer people in terms of reducing overdoses in the counties that you serve?
So we do NARCAN training, and we provide NARCAN free of charge for our participants, and for whoever else may need it, you can just contact us and we can set up a NARCAN training for you.
Right, excellent. Now, do you offer any other services, syringe exchange and stuff like that?
Yeah, we have our syringe exchange where we provide sterile needles to our participants, and we take the used needles and dispose of them safely. We also have fentanyl testing strips, which come in clutch to let a participant know whatever they're using if it has the presence of fentanyl or not. And that can be for opioids or other drugs like cocaine and Molly.
Now, and people can just come up to the van and ask to receive some services, is that right?
Right, yeah, it's an anonymous program, so you just come up to the van, we'll sign you up, and we'll give you a card, and you can get whatever harm reduction materials you need.
And as you say, it's all free to everybody.
All free, yes.
Excellent. Now, Christina, I know that in terms of social media, I hear that you're a bit of a celebrity in the Hudson Valley. Can you let us know and let the viewers know a little of your Instagram and TikTok posts?
Sure. So I do harm reduction TikToks, and I post them on Instagram and Facebook as well. You can follow us. It's HVCS_SEP, SEP. I do get a lot of backlash for some of the stuff by people who are just have stigma against using drugs and harm reduction as a whole, but I'm going to keep on posting them.
Well, I admire you for your tenacity and your hard work on the SEP van or vans and the program. Now, I see, are you in the SEP van just now?
I am, yes.
Excellent. Well, keep up the good work, and thank you for coming on today. I appreciate it. Take care.
You too. Bye.
Drugs for fentanyl.
For demonstration purposes, there is nothing in here.
Open, open. Use the residue in your party favor bag to test. Shake, shaky. Do not touch the tip. Leave and mix for 15 seconds. One line indicates positive for fentanyl. 2 lines in negative.
I'm Marilyn Morales. I'm the Vice President of Addictions here at Center for Recovery. And here at Center for Recovery, we have a few programs that address substance abuse. 2 of our biggest programs are our opioid treatment program and our chemical dependency outpatient program. We provide methadone medication to patients on a daily basis, and we also provide outpatient rehabilitation services that include groups and individual sessions. To me, International Overdose Awareness Day means a couple of things. It means a day to bring awareness to those that we have lost due to overdose, and it also means bringing awareness to those that are left behind and really honoring both those people. It also is a day to educate and be able to talk about overdose to people that are here going through it. I think it's important to educate others and to be able to talk about such things, because if we educate and we talk about difficult things such as overdose, it may elicit someone to reach out for treatment, and that is exactly why we're here. That's kind of a loaded question. I mean, there's this whole, medical answer, which I'm not even going to try to answer. But I can tell you that I think that sometimes why people overdose is because other people really don't know enough about overdose that they can't help. And I think that part of our job is to educate others about overdose so that if they ever come in contact with someone, that they can help. I think that NARCAN is a big tool in that, and that has saved lives. We do offer NARCAN training here at Cornerstone, and even in the community, there's many resources for NARCAN. So one of my biggest recommendations is that any community member can be trained on NARCAN, and I think that is probably the biggest tool that we have to face overdose. A couple of days ago, Orange County sent, an alert, through email, that we had 10 overdoses in 24 hours. And that was pretty scary for us. Whenever we get those alerts, I really, I put it out there to the staff just so that they're aware, it could be our patients, it could not be, it could be peers of our patients. And I think it's important for our staff to know that this is happening there, out there. And, we have seen the increase in fentanyl use, and, we try to address it because it's happening with our patients. And, we try to offer, education and referral sources just so that they don't wind up being one of the statistics that we see in those alerts. That would be heartbreaking. And, also just so that our staff could be aware, this is happening and our patients are going to feel it and we're going to feel it. And, that NARCAN training is essential. We see it all the time in the news, someone that just learned how to use NARCAN and they saved a life. I think it's important for us to normalize it. I think that's what this day is really all about, that we need to normalize the discussion, the training about it. I think that what everyone should know is that we can help, that we are a big tool, and that's what we're here for. Anyone that is really seeking treatment can call our facility. Our phone number is 220-2146, and they can request to have an assessment done, and we can definitely assist. If this is not the place for that person, we can definitely make referrals to higher level of cares, hospitalization, and we can help save people's lives. If there's family members that need assistance, they can call as well, and we can refer them to resources in the community. We have actually been working hand in hand with Hudson Valley Community Services as far as they've been coming in and providing care management services. That has been essential to our patients, because while we can do counseling and we can do substance abuse services, but in order to really help patients, they really need other services like benefits, housing, even a food pantry. So we have made referrals to Hudson Valley Community Services in order to get that, and it has really just improved our services. It has really enhanced our services. We absolutely work in conjunction with our, sister agency, I guess our mother agency, which is Cornerstone Family Healthcare, and we can refer patients to behavioral health services, to medical services, and to specialty services, and then work together to get the patient feeling better in all aspects, as far as mental health and physical health. If anyone is looking for services, I encourage you to please call us. We are, or to come in person. We're located at 3 Commercial Place in Newburgh, and our number again is 845-220-2146. We are here to help.
Thank you to everyone who recorded videos for us. Next, Camilla Trischetti from our Ulster County Outreach Programme will conduct a virtual NARCAN training. After you watch it, you'll be given a phone number to call and request a free NARCAN kit. The number will be on your screen.
My name is Camilla Trischetti. I'm the Ulster County Outreach Program Coordinator here at Hudson Valley Community Services. Today, as we observe International Overdose Awareness Day and we remember all of the lives that have been lost or impacted by preventable overdose, we think about how we can empower our communities and give them the tools that they need to feel that they can reverse an opioid overdose. So today we're going to do a virtual NARCAN training. If you're in Ulster County and you need a NARCAN kit after you've watched this training, please call or text me at 914-610-5324. I'd be happy to plan a time and place to meet up with you and get you your kit. So let's get into the training. What are signs of an opioid overdose? An opioid overdose will typically look like the person is unconscious. They may not be breathing at all. If they are breathing, their breathing is very slowed, could be making kind of a gurgling noise, sometimes called the death rattle. Because they're not getting oxygen, they may be turning a bluish or grayish color. Their lips may as well. And if you pull their eyelids open, they may have pinpoint pupils. So you see these signs and you think, I think that this is an opioid overdose, you're going to want to try to wake them up first before administering NARCAN. We want to make sure the person is not conscious. So simple ways you can do that is clapping, making a lot of noise, give them a shake, yell their name. If they don't respond to that, go for a painful stimulus, taking your knuckles to their chest. This is a very common way to do it. It is called the sternum rub. You would push down. If you do it to yourself, you feel that that kind of hurts. It's not so painful that it would seriously injure them, but painful enough that if they were still conscious, even a little bit, you would hope that they would wake up from that. You try all those things and they still have not woken up. You're really concerned. You think it's best practice to go ahead and use your NARCAN. Trust your gut. So we're gonna get them in the position to get NARCAN. That is laying down on the ground or the floor or on a bed and with their head tilted up. If they're not laying down and they're too heavy for you to get down, just if they're sitting, you can tilt their head back and do the same thing. Just make sure that you can get that head tilted back so you can get up to the mucous membranes with the NARCAN, and you'll see that in a minute. But you got them in the position and you're opening your NARCAN kit to see what's inside. Inside you're gonna find 2 doses of nasal NARCAN, a rescue breathing mask, 2 rubber gloves, and these 2 little papers here, which we're going to explain in a minute. You got them in the position. You can use this time to put on your rubber glove, see if there's anything blocking their airway, and if there is, scoop it out. You're going to take out your first dose of NARCAN, and at this time you're getting ready to use it. You should also be calling 911. If it's faster for you to just administer the NARCAN, do that. But if you can, maybe get them on speaker while you're doing it, or designate somebody else directly, you call 911. It's important that we have more NARCAN coming to the scene or medical attention that a person could need.
One thing that I forgot to mention here is the Good Samaritan Law. The Good Samaritan Law here in New York State protects the person who is overdosed as well as the person who administered the NARCAN from any kind of legal ramification relating to the overdose, such as possession of drugs. However, it does not protect you if you are possessing more than 8 ounces of a controlled substance, and it also does not protect you if you have an open warrant. You may hear many cases where people say that they are afraid to call 911, or stories where somebody had overdosed and nobody had Narcan, but they were afraid to call emergency services, maybe because they didn't know about the Good Samaritan Law. So I think it's important to spread the information about that, make people feel more comfortable calling emergency services in the case of a potentially life-threatening event, such as an opioid overdose, and save more lives.
A good thing to mention about calling 911 is that you may want to use terminology that is more like this I have a person here who is not breathing, or I have a person who is unconscious. Avoid saying that you have a person who has overdosed or that you think has overdosed. Describe the medical conditions that you're seeing so that the appropriate response will come. So now we take our first dose of Narcan. There's 4 steps that we traditionally say when we give a Narcan training, but they are peel, place, press, replace. So that first one is peel the package open. Second is place. So you got them with their head tilted back, and you're gonna place it far enough up their nostril that your fingers are almost touching the bottom of it or are touching it. Third step is press. So you press the plunger up and administer that dose of Narcan. There is only 1 dose of Narcan in one of these plungers, so make sure that you never test it. If you did, the whole dose would be gone, and that's less Narcan that you can use to revive the person. So before you give the second dose of Narcan, you should wait a full 3 minutes after you've given the first dose. The reason is that it could take a full 3 minutes for the Narcan to have an effect on the person's brain, and we don't want to give anybody more Narcan than they need. Narcan, for people who have a chemical dependency, is going to send them into an immediate state of withdrawal. They may feel very sick, they may feel agitated, and they may want to use again immediately, but it's so dangerous for them to do so in that time when they've just been revived with Narcan. The reason is because Narcan only lasts for about 30 minutes to an hour, whereas the effects of opioids can last for much longer than that. So once that Narcan's worn off in their body, the opioids can build up and cause them to overdose again. That being said, if the person's starting to come to after that first dose of Narcan and they're moving around and they're kind of making noises, maybe pushing you away, they don't need more Narcan. They are awake, so we're gonna do some other things for them, put them in the recovery position, which we'll mention in a minute, and encourage them to get medical attention. But let's say the person did not wake up and you need to use a second dose of Narcan. You do the same exact thing, you peel it open, place it in their nose, far enough up with their head tilted back, press the plunger. So at this point, you've given 2 doses of Narcan. If the person wakes up, then you should tell them that you've called 911 and that they are on their way. Let the person decide what they will do from there on. They may not want to get medical attention, although it should be encouraged. If they don't want to get medical attention and they're gonna go somewhere else, then really just stress to them that someone should be with them for at least 3 hours. If they'll let you stay with them, that would be great. We know that doesn't always work out. But really just stress the importance of not using again in the time that the Narcan is still in their system. If you need to leave them for any reason and they're really not up and about like that, then you can put them in the recovery position, which is what I just mentioned a minute ago, but you will put their hands under their head, laying on one side, and then their opposite knee here on this side will be tilted over so that it keeps them from rolling over. After that, we've moved into the replace portion of peel, place, press, replace. You're going to replace your Narcan kit. So these forms that I mentioned before, whoever you got your Narcan kit from probably gave you something like this. In my case, I always write my name and phone number here so you can call or text me to get a new kit. We'll also fill out the opioid overdose reporting form. It is anonymous. It doesn't ask very specific questions. It's just demographics, how much Narcan was used, if the person survived, so we can get an idea of what's happening in the community. And this last pink form is your standing order, which acts as a prescription for your Narcan since it is a prescription drug. Well, that is the short version of a Narcan training. If you have any questions, please feel free to reach out to me. You can reach us at that number, again, 914-610-5324. We're also on social media at Ulster County Outreach Program. Try to engage with folks on there about harm reduction education and get the word out about Narcan delivery here in Ulster County. So thank you all for attending this training and have a great day. Bye.
Thank you to Camilla for that important information. This concludes our virtual observance of International Overdose Awareness Day. If you would like to review anything, you can re-watch this video immediately after its premiere. Please contact us with any needs, questions or comments you may have. You can reach us through Facebook or visit www.hudsonvalleycs.org. There are a wealth of resources out there for those at risk of overdose and their loved ones too. We want to hear from you. I hope you found today's events to be meaningful and helpful. When it comes to ending the overdose crisis, it's time to remember. It's time to act. I'm Andy Reid, and I wish you and your loved ones health and happiness. Goodbye.